Manual muscle testing. Hip flexion. The patient sits short-seated with knees hanging off the edge of the table. The examiner places one hand at the shoulder to stabilize and the other at the distal femur. The patient drives the hip upward while the practitioner places a downward force resisting the motion. This occurs for 5 seconds and then a brake test is applied. Hip extension. Patient lies prone and the examiner passively flexes the knee, places one hand at the proximal hip to stabilize, places the other hand at the calcaneus. The patient then drives the calcaneus up in the air while the examiner applies a downward force resisting this motion. This lasts for 5 seconds and a brake test is then performed. Hip adduction. To manual muscle test the tensor fasciae lata, patient is side-lying. The examiner places one hand at the iliac crest to stabilize and the other hand at the lateral malleolus. The patient is then informed to abduct the hip straight in the air while the examiner places a downward pressure for 5 seconds and performs a brake test. Manual muscle testing for the piriformis is where the patient is side-lying with the hip and knee flexed. The examiner places one hand on the iliac crest to stabilize, making sure the pelvis is perpendicular to the table. The practitioner applies the other hand at the lateral joint line to apply pressure. The patient then is instructed to resist this motion for 5 seconds while the examiner applies a brake test. Patient lays side-lying and the examiner places one hand at the iliac crest to stabilize and the other at the lateral malleolus. The patient is then instructed to abduct the hip and extend the hip. The practitioner applies a downward pressure and resists this motion for 5 seconds and applies a brake test. Trunk flexion. Patient lies prone. Examiner places one hand on the ASIS nearest to her, places the other hand on the center of the sternum to apply resistance. Patient is informed to bring the chin to the chest and perform a sit-up for trunk flexion. This is held for 5 seconds and a brake test is then performed. Trunk extension. Patient lies prone. Examiner places 2 hands on the scapulae, applying resistance. The patient is then informed to extend the trunk while the examiner applies resistance. This lasts for 5 seconds and a brake test is then performed.
Sacroiliac joint fixation test. The subject stands with the sacroiliac joint exposed. The examiner stands behind the subject with the hands over the posterior superior iliac spines. The examiner should know whether the posterior superior iliac spines are level. A positive finding is if the posterior iliac spines are not level, the sacroiliac joints are asymmetrical, indicating fixation on one side or another. Gillette test. The subject stands while the examiner palpates the posterior superior or iliac spine bilaterally. The subject flexes one hip and brings the knee to the chest while the examiner maintains palpation to each PSIS and assesses overall sacroiliac movement. A positive sign is noted if the PSIS on the ipsilateral side of the knee being flexed does not move or moves minimally to the inferior direction. Standing sitting forward flexion test. Its purpose is to assess the mobility of the ilium or sacrum. The patient's positioning can either be standing or sitting. Palpating the PSIS while the client slowly forward bends with the lower extremity straight and hands reaching toward the floor. Segmental movement should begin with the lumbar spine, then sacrum, then the innominate. A positive test is asymmetrical movement, with the pathological side being the one that moves more.
Sacroiliac joint stress test. The subject lies supine. The examiner stands next to the subject and with arms crossed places the heels of both hands on the subject's anterior superior iliac spines. The examiner applies outward and downward pressure at the heel of the hands. Positive finding, unilateral pain at the sacroiliac joint or in the gluteal or leg region indicates an anterior sacroiliac ligament sprain. Squish test. The subject lies supine on the table while the examiner places a hand on each of the iliac crests and the anterior superior iliac spines of the subject. The examiner compresses downward and inward at a 45-degree angle along the iliac crest and anterior superior iliac spine bilaterally. Subject complaints of pain are noted as positive findings and may be found anteriorly or posteriorly.
Single leg stance test. The patient stands with the body weight evenly distributed between the 2 feet, shoulder width apart, and hands on the hips. The examiner stands behind the patient, ready to provide support if the patient begins to fall. The patient lifts one leg, then places the trunk in hyperextension. The examiner may assist the patient during this motion. The procedure is then repeated for the opposite leg. Pain is noted in the lumbar spine or SI area.
Long sitting test. The subject lies supine with both hips and knees extended, and the examiner stands with the thumbs on the subject's medial malleoli. The examiner passively flexes both knees and hips, and then fully extends and compares the position of the medial malleoli relative to each other. The subject then slowly assumes the long sitting position, and malleolar position is reassessed. A leg that appears longer in supine position but shorter in long sitting is indicative of an ipsilateral anteriorly rotated ilium. Conversely, a leg that appears shorter in supine position but longer in long sitting is indicative of an ipsilateral posteriorly rotated ilium. Major's test. The subject lies supine on the table. The examiner passively flexes, abducts, and externally rotates the involved leg until the foot rests on top of the knee of the non-involved lower extremity. The examiner then stabilizes the uninvolved ASIS with one hand and places the other hand on top of the knee of the involved leg. The examiner then slowly abducts the involved lower extremity, bringing the knee closer towards the table. A positive finding is revealed when the involved lower extremity does not abduct below the level of the non-involved lower extremity. This may be indicative of iliopsoas, sacroiliac, or even hip joint abnormalities. Gainsland's test. There are 2 variations. In the first variation, this patient is lying supine close to the side of the table. The examiner is positioned at the side of the patient. The examiner slides the patient close to the edge of the table, and the patient pulls the far knee up to the chest. The near leg is allowed to hang over the edge of the table. While stabilizing the patient at the ASIS, the examiner applies pressure to the near leg, forcing the hip into extension. In the second variation, the subject lies on the side of the uninvolved leg, the lower leg, with the involved leg, upper leg, in slight hyperextension. The subject then flexes the knee of the uninvolved side toward the chest. The examiner stabilizes the subject's pelvis and further extends the subject's involved leg. Pain in the SI region is considered a positive finding and may be associated with SI joint dysfunction.
Yeoman's test. The subject lies prone on the table. The examiner places one hand at the distal tibia and the other at the distal femur. The examiner passively flexes the subject's knee to 90 degrees while simultaneously extending the ipsilateral hip.
Like a girl you've ever seen before. Nothing you can compare to your neighborhood. I'm trying to find the